Maternity wards are shutting down all over California and throughout the U.S. This is having a drastic impact on many women, forcing them to travel further and wait longer for care. For example, recently in California, the maternity units were shut down at USC Verdugo Hills Hospital in Los Angeles. Beverly Hospital in Montebello shuttered its labor and delivery department, and Ridgecrest Regional Hospital in Kern County now has limited service. These hospitals serve tens of thousands of California patients. The shutdowns nationwide have had the most dramatic impact on patients with Medicaid insurance. Medicaid is the taxpayer-funded, government-provided plan for people who cannot afford their own health insurance. In fact, Medicaid pays for more than 40% of baby deliveries in the United States. And Medi-Cal, which is California's state version of Medicaid, pays more than 50% of deliveries in the state. And while there is an argument to be made over exactly who should be eligible for Medicaid and Medi-Cal, and what's fair, given the fact American taxpayers fund these government plans, despite the politics of this argument, the maternity ward shutdowns are taking a toll on patients. To find out more about this crisis, we traveled here to Pomona Valley Hospital Medical Center, located in Greater Los Angeles. Greater LA is the most populated area in California with millions of residents. This Pomona hospital has one of the busiest maternity departments in the state. And the medical center borders massive LA and San Bernardino County, serving thousands of patients in this high-risk maternal fetal program. This program that helps care for all women, thousands of women, include low-income women and families, and it's now been forced to take in patients from all over California due to the shutdowns all over the state. California has experienced a higher rate than other states, with some 60% occurring within the last 3 years. And they're not limited to sparsely populated rural areas of California. Nearly 20 closures were within very busy and densely populated LA County.
If I didn't love her as much, I wouldn't be here the whole 7 days. There's other issues to be taken care of, but those can wait. Right now what matters is her and being her companion, being by her side.
This is Luis Andrade and Regina Alejandra. Regina has been a patient here at Pomona Valley Hospital Medical Center for over a week. Regina is very ill due to her high-risk pregnancy. She's being treated for a potentially life-threatening thyroid infection, which has now given her chronic hypertension, all brought on due to the pregnancy. It took Luis and Regina a few hours to get here on the freeway. The couple lives in Ridgecrest, California, which is about 150 miles away from the Los Angeles area. Maternity wards closer to where they live have been shut down, so that's been a problem. Also, Regina needs Pomona Valley Hospital's highly specialized maternal fetal department due to her serious health condition, which has taken a toll both physically and mentally.
It's been frustrating as well, like I said, not being able to control anything or being around what I need and stuff. It's just harder for us to go everywhere else.
Luis says a maternity ward shutdown crisis here in California has been tough on the family, a family just struggling to survive. Luis admittedly says they basically have no money. He's trying to find a new job and the couple is surviving on his unemployment, and now they have no car.
We had to drive 3 hours away. Our transmission blew, and the last hospital we're at said that we denied transportation, and we blew our transmission 5 minutes from here. So we don't have a ride back. And yes, it's very stressful, especially knowing that we don't have a ride anymore. Our car is broken down, it got towed away, it's gone. We don't have the money for another car. Just being far away from home in general.
Yeah, the cost to come out here and stuff.
The hospital is not more than a few blocks away. And it's not a problem. But now that she has the thyroid infection, they want her to come in every 2 weeks. We don't have a vehicle anymore.
Yeah.
And I can't afford to be renting a vehicle all the time.
For now, Luis says the car is the least of his worries given the serious health condition of Regina, and knowing how much worse things could have been for her had they not gotten to this hospital for treatment due to all the maternity ward shutdowns statewide.
Overwhelmed me to the point that I cried. And I didn't know how bad and severe it could have been. They call it the silent death. And it just comes out of nowhere. It's a high blood pressure thing caused by the thyroid infection.
Pomona Valley Hospital has a state-of-the-art neonatal intensive care unit, also known as an NICU. This is for infants who require special care. The hospital here treats sick babies born in its women's center or babies who need to be transferred here from the surrounding areas. This center has a dedicated neonatal transport department, and the medical team here includes pediatric specialists who are physicians practicing everything from cardiology to neurology. There are also registered nurses, respiratory care therapists, developmental therapists, medical social workers, the list goes on. And this NCIU also has what's known as a NICView webcam system. This advanced technology allows parents and families of ill newborns to be with their infant virtually when they're unable to physically be at the hospital. A specialized care team with a high-tech solution for patients like Regina.
I'm getting help here. I feel a lot better. So it's good to know what's going on now.
Dr. Richard Berwick is a maternal fetal medicine physician here at Pomona Valley Hospital Medical Center, where he serves patients from all over the state, including Greater LA's San Gabriel Valley and Inland Empire. For more than 20 years, Dr. Berwick has specialized in providing care for women experiencing high-risk pregnancies. Dr. Berwick says the maternity ward shutdown crisis throughout California and the U.S. has been devastating.
It's a major problem that we're seeing in terms of maternity care, like you said, throughout the United States. And there's, because of hospital closures of labor and delivery units throughout the country, we're seeing basically what we call maternity deserts, where patients don't have access to obstetric care within their vicinity, within their town, within their county. They may have to travel long distances for care. And this happens even within California. California is not spared by this phenomenon. We also have maternity deserts in terms of hospital closures, obstetric closures. They're happening just as much in California, Southern California, as it is in other parts of the country. And I'm a high-risk specialist, and there may not be enough high-risk specialists in certain areas where there's maybe lower volume hospitals closed, and they may not have the high-risk maternal fetal medicine expertise. So we see patients come to our office for consultation, sometimes driving hours for, say, an ultrasound consultation to check on baby, to provide some genetic counseling, to provide diagnostic tests, and make a plan for the pregnancy. So we have to think about any medical condition that could impact the pregnancy. Common things that we see in our community: diabetes, hypertension, obesity. Now we're seeing more heart disease in younger women, twin pregnancy, and then we see maybe birth defects that babies have. And so we have to make up sort of high risk, I think of it. We make a plan for the primary care OB/GYN better. One, we counsel the patient and give them the information, tell them what to expect, and then make a care plan going forward. For example, in some cases of a complex heart abnormality, we have to decide where is the safest place to deliver, what's needed immediately after delivery. Is that child going to require cardiac intervention, heart surgery? So these are really complex issues that we have to coordinate.
Dr. Berwick explains that hospital maternity departments all over the U.S. deal with tens of thousands of patients like this each year with these serious health complications. And tragically, he says, as these medical cases increase nationwide, the number of obstetrics departments are decreasing. Why is this happening? Why is it so bad throughout the nation, and particularly here in California?
Yeah. I think to be a big part of it is insurance, and particularly those hospitals that care for patients with Medi-Cal or Medicaid based plans. The reimbursements are poor, and so this affects the hospital, and it also affects the physicians caring for those patients. And California has, relatively speaking, one of the lower rates for obstetric care reimbursement through Medi-Cal, which is that state version of Medicaid. It sometimes seems like there's no reason for it. Like if we want to see a patient, we should be able to see a patient. And a lot of the Medicaid plans are now managed care Medicaid plans, which means that we need prior authorization, and that causes large delays. So we say we want to see the patient, but they can't get in. They're not authorized. They're not authorized to get the diabetes counseling. We have this great nutrition program, and the insurance says, sorry, we're not going to cover that nutrition program, which we know how well that program works and how much patients improve when they're on that program. And then just seeing patients later than they should. So, and we see them, we're like, why weren't you here a month ago? And they said, well, I switched jobs, my insurance changed, I was waiting for authorization, I couldn't afford it.
For more context about the financials of this maternal care crisis, Medi-Cal has disastrous reimbursement rates for obstetric care. California's reimbursement rates are the fifth lowest in the nation. That's insane. And that low rate is also part of the reason so many maternity departments throughout the state are shuttering. And in this state, even the most busy departments with low-income Medicaid patients, well, they don't even break even. In other words, many of them are operating in the red. They basically have no money. The doctor reimbursement that Medi-Cal pays is below the market cost for providing maternal care. And this deficit is helping fuel all the California closures. However, it's not just California. Women all throughout the U.S. are also dealing with this healthcare crisis, adding to the increase in the United States maternal death rate. From about 2011 to 2021, that decade, a quarter of all rural hospitals with maternity wards shut their doors to pregnant women. And many of those nationwide hospitals, well, they had to absorb all the exorbitant costs, and there were doctor shortages. They were concerned about all of that. They were some of the reasons all the shutdowns were taking place. And hospitals say the situation, well, it's just getting worse. So in 2023, the number of medical students applying to obstetrics residency programs, well, they drastically declined according to the AMA, the American Medical Association. So places like, let's say, Texas, Alabama, Tennessee, they're all now taking a mega hit. And more than a third of US counties, mostly in rural areas, particularly in the South and Midwest, well, they don't even have an obstetrician or a maternity ward.
And it's two things. One, yes, the Medicaid reimbursement could be better. Also, private insurances are too expensive. One reason we see so much patients on Medicaid-based plans is that the private insurance, commercial insurance options are too expensive. So we take care of a lower income population, and and the cost of those private plans are just too much. So it's sort of a twofold effect that we see. The cost of the insurance is the premiums are becoming a larger percentage of someone's paycheck, basically how they have to spend their monthly allotment that they have from their income. They're working individuals in many cases, but the premiums of their insurance plans, the deductibles, co-pays, it's just adding up to be too much. And so that's what's really adding and contributing to the problem.
What does it say about our healthcare system today when a woman has to get in her car and get on the freeway for 4, 5, 6 hours? You have a patient from Mammoth Lakes. That's insane. That's 6 hours away from the greater LA area. What does that say about this crisis?
It tells you, really emphasizes the scope of it, that a patient will have to drive 5 to 6 hours to get care from a specialist. And that's a disruption to their everyday life, of course, with their work, with their family, just that alone, the logistics of doing that. But the fact that they have to do that they don't have the access, why is that? And like you said, it does kind of go back to people are closing because the reimbursements are poor. So we're losing doctors, we're losing labor and delivery floors, and that the distance that they travel is kind of showing you how big the problem is.
To find out why Medi-Cal reimbursement rates are so low in California and why there's not more money in the state budget for healthcare, I contacted the office of Governor Gavin Newsom. First, some context. During COVID, California received billions of dollars in federal funding from the Biden administration. A massive state budget deficit was instantly erased, and Governor Newsom now had some money. So it seemed to reason there should be more funds for healthcare in the coffers. However, as always is the case in California, the funds were gone soon thereafter. Today, the state again has billions of dollars in deficit. The question is, where did all the COVID bailout money go? Newsom critics, of which there are many, say the governor wasted some of the newfound COVID cash on things like climate change initiatives, pork projects, and bridges to nowhere. And critics of the way Medicaid and Medi-Cal are distributed also say that Newsom, as well as Democrat governors of other blue states, made the wrong decision to include illegal immigrants as recipients of the taxpayer-funded government health insurance, because that decision has taken a toll on state budget finances. Even more so, the insult to many Californians is that the Golden State is the highest tax state in the nation, depending upon who you talk to, and yet California is broke. Many voters simply say they're worn out with all the financial mismanagement on the part of Governor Gavin Newsom and the state of California. Governor Newsom and his office declined our request for an interview. Adding to this challenge, Dr. Berwick says, is the simple fact there are now far fewer people going into medicine these days, and that's also fueling the maternity ward shutdowns. Dr. Berwick says the pay is the worst it's ever been for physicians, And with the lower take-home paycheck, the hundreds of thousands of dollars, if not more, in student and medical loans, and the blood, sweat, and tears hours, many young people who initially opted for a career in medicine, and specifically obstetrics, are now going into other fields.
Yeah, it's definitely a challenge because also the students, say undergraduate students, medical students that are looking at that, they're hearing about all of these concerns, looking forward and deciding what they want to do with their life. And that may take them out of medicine, which would be unfortunate if they go away from that. Or even those that are in medical school, they're just hearing, oh, I need to be a subspecialist because primary care doesn't reimburse. And so now you have a drain on primary care field. But we work with local medical schools. We have one Western University close by that we work with. We work with a lot of trainees, residents that want to come through our hospital. So we're always trying to sort of train the next generation of physicians.
Dr. Claribel Solorio is one of those next-gen physicians. Dr. Solorio is a second-year maternal fetal medicine fellow. She recently completed her residency and most of her medical training, and now she's collaborating with Dr. Berwick, possibly to eventually work with a hospital in the obstetrics department or the community clinics and the Medi-Cal patients Pomona Valley Hospital serves. Dr. Solorio knows more than most about the healthcare crisis. She remembers how her own family often had to travel many hours just to visit the doctor.
It's definitely very challenging and very long to become a physician, but I think my story starts with my parents who immigrated here from Mexico to give us better opportunities and more opportunities than what they had. And so that's one of the main reasons why I became a doctor, is just because I wanted to bridge gaps, particularly with underserved patients and underinsured patients and patients who were Spanish speaking and didn't really know how to navigate the system or didn't really understand all of the options that were being presented to them. I was raised in Mammoth Lakes, California, born in Bishop because it's a little bit of a bigger hospital, but both of these small towns are very far away from the nearest big center where they can receive care. So a lot of my family members just had to travel 4 or 5 hours in order to get basic care when they were pregnant or when they just needed any sort of even slightly higher type of care than what they could get with a family medicine doctor. And you know, twins run in my family, so like all of my family members who were pregnant with twins just had to travel 4 or 5 hours to be seen by a high-risk specialist. And that was a huge burden with just finances and other children. Certainly are a lot of challenges just with the reimbursement rate for doctors. And I think that has become one of the reasons why some doctors are choosing to no longer work in areas where they do take Medi-Cal patients. But I think that there's still an opportunity to partner with certain types of groups that see both a combination of private and public insurance patients so that they can still continue treating the patients who do have Medi-Cal, Medicaid, but can still continue to make some money from the private insurance patients so that we can still find a lot of fulfillment in our job and we can make sure that all patients are receiving really wonderful care.
One of the things with pregnancy is that it can turn from being a completely normal pregnancy to being in a very emergent situation very quickly.
Dr. Maria Helen Rodriguez is part of the specialized physician team at Pomona Valley Hospital Medical Center. Dr. Rodriguez has dedicated her entire life to this hospital, working here nearly 40 years. Dr. Rodriguez is the medical director of Maternal Fetal Medicine Services.
We cater to patients with all different types of pregnancies, the very low risk, including to the very high risk patients. So if the mother has some kind of medical complication, either secondary to her pregnancy or because she had a medical condition before becoming pregnant, that makes them high risk, not only for themselves, but also for their babies. So we especially take care of them also. And we not only cater to our immediate community, but we also do a lot of outreach. So we go to communities that are as far away as Mammoth or Ridgecrest that are 200, 250 miles away. We get patients from those areas that come to see us because we welcome really any patient. It doesn't matter what their ability to pay is or isn't. We really do try to take care of everyone. Some of the high-risk things that we see, the most common high-risk things are things like preterm labor. About 9% of patients go into preterm labor, so there are ways that you can either prepare the baby for early delivery or try to stop the preterm labor that we are able to deal with. Another fairly common thing is preeclampsia. Preeclampsia is something that is very common in patients that may be pregnant for the first time or patients that are pregnant when they become a little bit older, which we're seeing more of now. So high blood pressure problems is something that is dealt with. We also deal with patients that maybe have had cancer before their pregnancy, or maybe it's been diagnosed during their pregnancy, any cardiac condition. Now we have babies that were born with cardiac abnormalities that had some kind of heart surgery, and now they're pregnant and becoming moms, so they are high risk also.
In addition to the poor insurance reimbursement rates, fewer people going into the field of medicine, and financial mismanagement on the part of the state, Dr. Rodriguez adds another possible reason for all the maternity ward shutdowns.
We do have a decrease in fertility rate, and with the decrease in fertility rate, there are less deliveries. When you have very few deliveries, it's impossible to keep your hospitals open because you don't have enough patients delivering, not only financially, but also in terms of maintaining your expertise. So if you are only doing a delivery every 3 days, then your nurses are not able to get the experience that they need, and they don't want to work someplace where there's no experience, even if you were able to hire them. So it's hard to get personnel to come to a place that is not delivering very many babies. I think that's part of it. I think part of it is, deliveries or OB affects women, and women have always been the lowest priority when it comes to our system. So I think we need to change that. We need to really focus more on women, because really without women, you have no society, really. You need the women, and you need to make sure that they're well taken care of. So I think that, and making sure that we all really just take care of each other. But money and the decreased fertility, decreased expertise in our providers.
What is a possible solution so that these maternity wards don't have to keep shutting down, so that women don't have to drive hours on the freeway to get here? Or is there a solution?
Yeah, definitely we need more access to care, but how are we going to get more access to care? In some cases, some new hospitals will build a new obstetric unit, but actually some new hospitals being built don't include an obstetric unit. So there has to be definitely intense focus on maternal health. That can come from multiple levels. The state level, like you said, in terms of funding, prioritizing healthcare dollars for Medicaid, because a lot of pregnant women are on Medicaid. A large portion of deliveries are on these Medicaid plans. So we either need to make that process better, improve reimbursements to make it feasible for physicians and hospitals to be able to maintain that practice. The other, continue to work on private insurance and not allowing them to keep escalating costs, because our patients do want commercial insurance in many cases. So that's another angle that we can kind of improve that. So insurance is a big piece of it, but investment from the hospitals, local resources, and people kind of advocating for women's health in general. It is really heartbreaking when we know that we could have prevented some of these complications.
Well, as a person, as a mom, a sister, a daughter, it's really heartbreaking to see that many women do not have the support that they really should have, that everybody deserves. And I think it's all of our jobs to try to see how we can lend a helping hand, not necessarily as a doctor or a nurse, but really as a fellow human being. I think that we should do whatever we can in our communities to make sure that women do have access to the care that they need.
Thank you so much to all the great folks here at Pomona Valley Hospital. Their help was so greatly appreciated for this special report. Now, for more information about our program, just click on klcs.org and then click Contact Us. Send us your questions, your comments, even your story ideas so we can hear from you. Or you can contact me directly at David Nazar News on X or on YouTube, or just go to David Nazar News and contact me there. And be sure to catch our program here on PBS or catch us on the PBS app. Thank you so much for being here.